Hi, my name is Jennifer Harris. I am with the COVID Collaborative, which is a national organization that is working to educate and help people overcome vaccine hesitancy. I'm here with you today as part of the United Methodist Women and Texas Impact Conference, and am pleased to be joined by Dr. Peter J. Hotez. Dr. Hotez is Dean of the National School of Tropical Medicine and Professor of Pediatrics and Molecular Virology and Microbiology at Baylor College of Medicine, where he is also the co-director of the Texas Children's Center for Vaccine Development and Texas Children's Hospital Endowed Chair of Tropical Pediatrics. Dr. Hotez is also responsible for leading the efforts at Texas Children's Center for Vaccine Development to develop a low-cost recombinant protein COVID vaccine for global health, resulting in emergency use authorization in India. He makes frequent appearances, as you've probably seen on cable news and reading him in local newspapers. He's a passionate advocate, obviously, for vaccines and for overcoming disinformation and vaccine hesitancy. I'm very grateful to have him join us and would like to give a special thank you to the Immunization Partnership, which was so helpful and instrumental in bringing him here to us today. So for our small gathering here in Austin, to our extended online community across the state, Dr. Hotez, welcome, and thank you so much for joining us.
Well, thank you so much. Sorry I could not be there in person. It would have been very nice to do that, but post-apocalypse, hopefully that will eventually happen. Nationally and in Texas, of course, we're in the middle of this very large and concerning Omicron wave, and this virus is, of course, the most transmissible of anything we've seen. It's as transmissible as almost as a measles virus infection, which is, before now it was considered the most transmissible common virus agent, and that can sweep through populations very quickly, and that's how we're getting these extraordinary numbers of hundreds of thousands of new cases a day and breaking all records. And here in Texas now we're about 60,000 new cases a day, which is at least about 3 times higher than our highest peak. There's sort of a good news, bad story about that. The good news is, as we've all been hearing, the severity of Omicron, of this Omicron variant, which accounts for just about all the variants, is not as high as previous lineages, but it's still high. And I think that's the point that people don't quite understand. There's been a lot of happy talk about the virus, that it's, some people are even calling it Omicold, meaning to kind of disparage it as a insignificant pathogen. It's not the case. Both the hospitalizations and the deaths are climbing. So we're once again at 2,000 deaths per day. And it's because even though on average the individual Omicron case is not as severe, especially for the unvaccinated, it's severe enough and it's still causing lots of hospitalizations and deaths. I think the other piece that's happening, of course, is the fact that so many healthcare providers are out of the workforce now because they're sick at home with COVID. Even if they're vaccinated, they're still getting breakthrough infection, especially if they only got 2 vaccines. So what you're seeing now is this 1-2 punch for Omicron, where too many people are still unvaccinated, piling into hospitals, and are not enough healthcare providers to take care of them. And that creates a dangerous situation when you get emergency rooms and ICUs overwhelmed, and not only with the Omicron patients, but with everything else, because the heart attacks, the strokes, and the other serious illnesses never really went away. They're still here. And so this is why we're all kind of scrambling, trying to figure out how to manage these surges when so much of the healthcare workforce has been knocked out. So that's problem one. The other problem is 2 of the 3 monoclonal antibodies that we've been having available for COVID-19, 2 of them do not work against Omicron. So we've only got 1 monoclonal antibody that seems to work, and that's from GlaxoSmithKline, the one from Vir/GlaxoSmithKline. Vir is a biotech company. And that 1 monoclonal antibody is not here in abundance on many hospital formularies, so therefore that has to be rationed. We also do not have the very excellent Pfizer drug Paxlovid available here in abundance. So that's also a problem. And the remdesivir, the one drug that we do have, has to be given parenterally in a hospital-like setting. So that limits its use as well. So when you combine all of those things, we wind up having a pretty dangerous epidemic on our hands. The other piece to this now is we are learning about the importance of getting that third immunization. So if you've gotten 2 doses of either the Pfizer or Moderna vaccine, but have not gotten your third dose, that's not good, because what we're seeing is only 2 doses of the vaccine is about 38% protective against ER visits and 57% protective against hospitalization. So you need that third immunization, and that brings it up to the 80 to 90% range. So if you haven't gotten boosted, get boosted. I don't even like calling it a booster. I've always said this was a 3-dose vaccine, and that's being borne out. And now the CDC has given some alternative language, which I think is a little too cutesy. I don't know quite why they're doing this. They're still saying 2 doses is full immunization, but you have to be, quote, updated on when you got your last immunization. I'm not quite sure I understand the reason for that, but the bottom line, get your third dose, and that will likely keep you out of the hospital and the ICU or the emergency room. And then the question is, what's next? What's the next big thing? And Tony Fauci on the Sunday talk show says Omicron is starting to go down in the Northeast a little bit. So that's a good sign, and hopefully that trend will continue. Now, the question in the Northeast is whether it continues to go down at the same level or whether it gets stuck halfway down in the plateaus for a while. We've seen that happen. So that's a possibility. And then for the rest of the country as well. And so the ideal situation would be by the end of this month that we're kind of down on our Omicron wave across the country, and that by the middle or end of February, we're kind of out of it. And that's the hope. There's no guarantee for that. And then the question is, what comes next? And, again, you're hearing a fair bit of optimistic projections saying, hey, that's the final last gasp, and now we're done. And I do not think so, and here's why. I think the Omicron variant, unless you've been vaccinated on top of it, the Omicron variant itself will not produce a lot of long-lasting, durable protection. I think it'll be like some of the other upper respiratory coronaviruses that will produce protection for only a few months. And if I'm right, then what that means is that we'll be vulnerable yet again, because we still have too few people vaccinated and too many people under-vaccinated as well, which is not good. 2 doses, not 3 doses. So for all those reasons, I think we have to be prepared about another summer wave across Texas and the southern United States. So we had with the original lineage in the summer of 2020, we had that big wave that was so devastating, especially in Hispanic communities. It caused what I call this historic decimation of Hispanic communities, and testified to the Congressional Hispanic Caucus about that. And then it happened again in 2021 with Delta. It was a terrible wave across Texas and the southern United States. And so I think we have every reason to expect that the same thing could happen again this coming summer. So Mother Nature's not being coy here. She tells us exactly what she has in store for us. And I think that's where we're going to be at unless the U.S. and the G7 countries show some resolve with vaccinating the world's low and middle income countries. And I emphasize that because that's where we're seeing these new variants of concern emerge. We had Delta arise out of an unvaccinated population in India at the beginning of 2021, Omicron out of an unvaccinated population in Southern Africa later in the year, just a few months ago. And I think we're going to have another one yet again last week and have that resolve to vaccinate the world. And that's why our vaccine that we developed at Texas Children's Hospital could have an important role, because it's specifically designed for global health. It uses the same technology as the hepatitis B vaccine that's been around for 3 or 4 decades and been given to kids for 3 or 4 decades. It's done through yeast fermentation technology. meaning that it's made as a recombinant protein in yeast. Like hepatitis B vaccine, it means it's a vegan vaccine. So a lot of people find that attractive because there's no human cells or mammalian cells involved, no animal proteins, human proteins involved. Simple to scale, you can make billions of doses. It's simple refrigeration, excellent safety profile. So it really does check a lot of the boxes that you would want for a global health vaccine. And we've licensed it now to 4 vaccine producers in India, Indonesia, Bangladesh, and Botswana. India is the furthest along, where they named the vaccine Corbevax. The BE part stands for biological E. That's the name of the company. They've got 250 million doses made, and with the capacity to make 1 billion doses in this year. So the hope is that these vaccines start filling that equity gap and to prevent the next serious variant emerging. And I've been challenging the World Health Organization to say, look, let's vaccinate the world before the summer so we can actually prevent that next variant. And we'll see if that happens. So maybe I'll stop there, Jennifer, and see, where we should go next.
Obviously, beyond the walls here in our online community, I know so many in the United Methodist Church and other denominations are very much involved and supportive of efforts, beyond our boundaries here in the United States to help and support access to healthcare and access to vaccines. So thank you, obviously, for you and your team's efforts in that regard. In fact, a lot of comments coming in online just expressing their gratitude from all that you've done in that area in particular. One thing I wanted to ask, as you were talking about, there were some audible sighs or groans within the room here about, a possible summer surge or additional surges on down the line in 2022 or beyond. What can you tell us from your perspective in terms of those of us living it every day and those of us in conversations within congregations that we live and work in, to talk about how we can overcome not only hesitancy, but at this point, fatigue. Certainly there's the need to get that third shot. There may be a need to get additional shots on down the road. So I guess what advice would you give in terms of conversations that we can have and that we as leaders in a faith community can have to make an impact?
Well, the only way to make this manageable is to max out your vaccines. And that means if you're an adult, or a teenager, getting those 3 doses. And that's what we're not doing. Especially among the teenagers and young adults, the vaccination rate's pretty bad here in Texas. It's a little better among older individuals, but in some parts of Texas, it's half the national average. Particularly some of the rural counties in central Texas, up in the Panhandle, East Texas, they're just not doing well in terms of vaccination. So trying to make that case, and especially those who've gotten 2 doses, the message is just, part of it is the fault of the federal agencies that they kept on saying full vaccination is 2 doses. And I think it never was. It was always a 3-dose vaccine. And I've said that since the beginning. So trying to get people fully vaccinated, that's your best hope to withstand the next variant that comes along. And if you've been infected before, also getting vaccinated on top of that really broadens your ability to fight new variants as well. So the importance of just striking that home and vaccinate. And then the little kids, the 5 to 11-year-olds, if the teenagers aren't vaccinated, their younger siblings aren't either. And so, reinforcing the importance of everybody getting vaccinated, that's our best hope for combating and withstanding the next variant of concern. We'll have more information about the kids under the age of 5, maybe over the next couple of months. We might see if some of the vaccines will be approved for the real little kids and how far down that goes. And we have seen a lot of pediatric hospitalizations across Texas and here in our Texas Children's Hospital, so that'll be important. So the best thing you can do is, look at your family and your loved ones and your friends and colleagues and, try to encourage them to get vaccinated and really fully vaccinated with those 3 doses. I think the other obviously is, when you're going through a surge, wearing masks in indoor gatherings, in indoor settings, that will help a lot. because this is such a transmissible virus. And recognize that the urgency of masks may go down quite a bit once this next Omicron wave goes down. You know, when you've got such a highly transmissible variant, your margin for error diminishes. You can get away with fewer things. So once this level of transmission goes down, if people can use this period to get fully vaccinated, if they're not already, that will help a lot.
Important. But in addition to vaccines and the masking, like you said, in settings when the spread is high and you're indoors or with large groups, but can you also discuss the role of testing? Is that still an important factor in all the struggles that we've had in terms of access to tests? How do we overcome that, or how important is that to address?
Well, especially if you're, visiting with people who may be especially vulnerable because they're immunocompromised, or they're at an age where if they're infants or they can't get vaccinated, or if they're extreme age and the protection is not as great as you'd like, being able to test before you interact with them, I think will mean a lot. Now, of course, you can get access to the home kits, which will help, and that's an antigen test. And it's not perfect. There are false negatives, but generally speaking, it seems to be certainly better than nothing, and will kind of mitigate your ability to spread this virus unnecessarily. And as I say, it's very much depends on the level of community spread. If with the level of community transmission as it is now, there's any mess up has consequences and means that you could inadvertently pass the virus on to somebody. Once transmission goes down, your margin for error improves and it makes it a little less stressful a situation. So I will say it will go down. I'm hoping by next month. What happens though after that really depends on our ability not only to vaccinate ourselves and everybody in the state of Texas, and the rates are still too low, but also internationally. And so stressing that is going to be very important.
Well, and I think that's a good segue to another online question, and then I'd like to take a question or two from here in the room before we wrap up. A question from online. As a virologist, can you say anything about the relationship between pandemics like COVID and climate change? Is there a connection there to be drawn? And what's your concerns that you see?
There is. In fact, the last book I wrote is called Preventing the Next Pandemic. And it actually looks at some of the big social and physical drivers that are bringing back disease. The irony is I wrote a lot of it before COVID. So a lot of it was written pre-pandemic, and turned out, to be right. And it looks at some of the things that, as physicians or some biomedical scientists, we don't ordinarily think about. Things like a war, political collapse, how that damages health systems, prevents vaccinations. Also urbanization and especially here in Texas, where our major cities have grown so exponentially, that's a factor. Human migrations, and climate change is definitely a factor, but oftentimes in ways that are not intuitively obvious. So for instance, with some mosquito transmitted illnesses, in some places on the Gulf Coast where the warming temperatures means we're more likely to have things like dengue and Zika year in, year out here on the Gulf Coast. But in other places, the temperatures rise so high that it could actually be too hot for mosquitoes and snail vectors for schistosomiasis. So it's going to redistribute a lot of illness. And of course, people who live in poverty tend to be more susceptible to climate change because they live in more climate vulnerable neighborhoods near bodies of water where flooding is a bigger factor, a low-lying area. So all of those are considerations as well. In Texas, what we have is the confluence of a lot of things that do make us susceptible to disease, like extreme poverty. That's a factor, and all its associated poor housing and lack of indoor screening and exposure to sewage and inadequate plumbing. That's a factor. Climate change and warming, that's a factor. Aggressive urbanization, human migrations. And guess what? That's the reason why I moved to Texas a decade ago, because we knew all of the confluence of those forces would drive up disease. And that's why, this is one of the few places in the country where we have pretty widespread transmission of tropical diseases, not so much because of immigration across the southern border, but the fact that we actually have transmission within the state of Texas of diseases like Chagas disease. So it makes for a very fascinating place for people like myself to be here.
Great. I'd like to take a question from here in the room. I know there were a couple that I thought I saw some hands. Yes, sir.
Other than getting people vaccinated, what is the best way to support the medical community?
Could you hear that, Dr. Hotez?
Yeah, other than getting vaccinated, what's the best way to support the medical?
Yes, sir.
Well, I think, one of the things we have to realize is a lot of the healthcare workforce has left the healthcare workforce. People use burnout or demoralization or whatever term you want to use, but nationally we've had about an 18% loss, and I think it's just the stress of taking care of so many sick and dying individuals with COVID-19, and then too often to have to be screamed at about unproven treatments that don't work, like ivermectin. I think that's really taken a toll on the healthcare professions quite a lot. So one of the things we need to start looking at now is how we're going to replace and bolster the healthcare workforce. And so looking, I think, at training and education options within our colleges and universities to expand offerings in the healthcare professions, or to provide incentives for people to go into the healthcare professions again, like nursing, not only being physicians, but also nursing and respiratory therapists, and all of that is going to be really, really critical, and maybe making low-cost loans available or loan forgiveness available. Those are some of the things that I think we're going to need to do to build back up our healthcare, our workforce and providers, and even just the simple act of kindness of being, kind when you see somebody who's in the healthcare professions in your grocery store, or see them wearing scrubs getting off of work, say a nice word to them, because it's been very tough for so many of us this year, and the aggression has gotten pretty bad as well. So I know that sounds a little bit vague, but again, the importance of wearing masks when you're in indoor settings, especially with this level of transmission, doing everything you can to prevent you from having to be seen and managed and treated for COVID-19. That in itself is huge.
Great. Another question from here in the room? Yes, ma'am.
I know a lot of people who will not get vaccinated because the government is not going to tell them what to do. And I don't know how we can get around that. Do you have any ideas?
Yeah, no, this is the problem. It's coming out of this sort of phony concept called health freedom, medical freedom. Hey, government can't tell us what to do. All I can say is, or among the things I can say is, you don't want to be someone who has buyer's remorse to be in a hospital setting or an intensive care unit, and they're going to tell you that you're about to have to be intubated or go on respiratory support for your COVID-19. Because at that point, it's too late to vaccinate. And that's what we really need to stress. I mean, and explain the numbers. The numbers are just so devastating. We're talking about 20,000 unvaccinated Texans, 200,000 nationally, about 20,000 Texans here in the state of Texas since last summer who lost their lives because they did not get vaccinated. So we have those numbers, and you can even do them yourself. You go to the Texas Department of State Health Services website. They have the percentage of people who died who are unvaccinated in 2021. It's about 85%, and the rest were most of them were partially vaccinated. And you have the numbers of 20,000 since June, when vaccines were widely available. So I think it's really important that we get that message out, especially to the clergy, that can have a lot of influence in the community, that's 20,000 people that could still be around right now, who are not, because of defiance over vaccines, and it is the most self-defeating thing I've ever seen as a healthcare professional. I don't even know what you call it. I don't even call it misinformation or disinformation anymore. I don't know, some form of self-immolation, and trying as best you can as a member of the clergy, especially to explain to people that these are good vaccines, they're safe vaccines, and they'll save your life. It's got to be the overwhelming message. I wish we got that reinforced better by some of our elected leaders. Some do, many don't. The other thing is, if you listen to the rhetoric that a lot of people provide, is not even that they're overtly anti-vaccine or the way they say it, but what they'll say, and you hear this from elected leaders, you'll even hear it from some clergy members, is they'll say, quote, "I got vaccinated, but everybody has the right to make their own decision." And that's the part that I think we have to cut it off, and "I got vaccinated," and change that message to, "and it'll save your life, and here's why." Because otherwise it gives kind of false equivalency to that health freedom, medical freedom concept, which is a killer. This business of health freedom, it has killed 20,000 Texans since last summer. And it is now one of the leading killers of young and middle-aged adult Texans here in the state. And we need to carry that message forward.
Do you have time for one more question, perhaps?
Sure.
Okay. From here in the room? Yes, ma'am.
Yes, I have a question. If a person like myself have had COVID, when I initially talked to my doctor, I was under impression that the antibodies would stay in my body for so long, but you just stated, I've had 2 shots, but you just stated that we're not fully vaccinated until we've had all 3, the 2, and then a booster. So
You'll have to repeat that one because
So do we know if we've had COVID and we've had 2 shots? Because my doctor told me that the antibodies will stay in my body for like a year. But you just said unless we've gotten the 2 shots and a booster, we're not fully vaccinated.
Did you hear that? I think it goes back to the question over what's really considered fully vaccinated. She was saying that she had COVID early, has since had 2 of the vaccine shots, but in conversation with her doctor, I guess was getting maybe confused or some different information as to what would last.
I mean, and there the medical community is a bit divided. If you've been infected with COVID and then gotten vaccinated on top of it, that's usually pretty strong immunity. And so the infection itself, if you've survived, could almost be considered like an immunization, like one of the vaccinations. So the doctor is correct in the sense that you've been infected and gotten 2 doses of vaccine, it almost would be like getting 3 doses. If we're up to me, I still get the 3rd dose. Because I think that will just add that extra layer of protection. There's no real downside to it. But if you've been infected and vaccinated, you potentially are in a pretty good position.
Great. Dr. Hotez, we so appreciate your time. If you have any parting closing remarks that you'd like to share with us, especially, as I say, as it relates to having some very active and engaged members of the faith community gathered here today and that will watch this after today's conference as well, what would you say?
I'll just say something that you probably have already figured out, which is that, this pandemic has not brought out the best in everyone, right? People react to extremely stressful circumstances in unpredictable ways. And I'm sure everyone has had friends and colleagues who've disappointed you in terms of how they responded. I just say, the way I'm conducting my life and affairs is giving amnesty to as many people as possible, because stress does not bring out the best in everyone, and we will get through this, and trying to maintain our level of kindness and respect is going to be absolutely critical for us to move forward.
Well, again, thank you so much for your time. We know you're an extremely busy man, and we're so grateful.
Thanks for having me.